Yeah, it's a robot of research because it's motor function for help patient and other approach.
So there are different kinds of robots. This one is what you call a passive robot, which only has springs in it that compensate gravity, but there's no active movement that robots can do. While this one has actually motors inside, and so it can also then do movements against gravity. So more severe patients usually should train more on this kind of robot, where the ones that already have some spontaneous electricity that is sufficient to compensate the gravity, and then train them in this way.
For articulation, it's important to respect different things. I do quickly for win time, but shoulder, elbow, wrist, and wrist movement and prosupination I don't do. I do quickly, but it's possible to put correctly for respect movement for the patients. And for setting of the machine, it's possible, Dr. Gisbert say it's passive, and it's possible to set for the setting to help patient for resistance, but it's necessary to do calibration correctly, because if you help too much patient, after it's difficult to go down. So it's necessary to feel the possibility of patient. Okay. It's not perfect, but it's okay. After two settings is very important. After with logiciel.
The software.
Yeah, software. Thank you. First thing, it's for all the movement of patient, of all articulation. It's a voluntary movement, so it's necessary to find the calculate l'amplitude.
Compute the amplitude.
The distance
It's the first thing, all the articulation, and after it's necessary to do a cube in 3D for find the possibility of patient. So it's necessary in this machine to have a beginning of recovery movement for the patient works with game, but it's possible with less movement to have a small cube of 3D, and it's possible to use exercise. So for motivation, if you use on the table for slide with two hands, for the patient it's difficult after to find motivation, and this it's very good for all patients for find another motivation. It's good with old patient and young patient. It's not the reason of old patient. It's very try. So it's good for this, and it's it's not a replace. It's complementary. Just take a difficult exercise for you. You eat skeleton, epilates. You eat with this thing, and so you all movement it's possible. And she close, and you eat when all the pirouettes. 2 minutes. It's possible to change time. For the patient, and a level of difficulty is possible. Less information with cognitive difficulty, it's easy to change, and it exists exercise most easy, just a little movement in grand pectoral, just this. It's possible to try. The therapist choice, and after the patient have 30 minutes, and it's possible to continue. No good.
Do you help the patient? Do you assist them in the shoulder movement? Oh no, I'm getting eggs in my head here. Do you sit with them and?
I'm here for just
shoulder blade
compensation. I'm here for. Compensation. I'm here for check compensation. Okay, be careful here because patient want
to use the body.
So I for the moment we think it's important to have a therapist with the patient, but I hope in the future there is a second machine try to do a group with the different